schools closures, in fact, doing more harm than good?
Yes, it is, but you have to take the risks and the risk-benefit analysis. And one of the things about opening schools is that one size doesn't fit all for all these schools. And so for each school system or school district or even individual schools, I think that the common sense rules that apply to, say, a nursing home situation actually applies to the schools also. Where you have social distancing, if possible, the hand washing and sanitizing use, and keeping the children. And the main thing really with the schools is the children, and some new studies have come out, about 20 to 30% are asymptomatic who are positive for PCR, for the virus. So they're shedding the virus, but they have no symptoms. This is true of adults also, which is a huge problem for schools. And the problem is not so much the children, the problem is the adults that they're in contact with, namely their teachers, the ancillary staff, people who are cleaning the schools, administration staff, and in addition, their parents and also elderly parents or grandparents who are within the household, where they come home and expose them. I think most people know the old scenario is that when a toddler comes home from a school who has a cold, the parents are in bed for about a week. And this is quite true of almost all viruses. And this is not any different from COVID-19, except the consequences are much more severe.
Right. Now, as you hear that there is, of course, a context to be kept in mind when schools or administrations say that we're going to reopen our schools, and you being a signatory of that statement that said that being outside of school really scars children. Now, keeping that entire context in mind, I do want to talk about what the cost is and mental health cost and other costs you see for why you would say schools that can